Welcome, IT changemakers, to the Deck Show with Tim Flower and Tom McGraw. Let's get into it.
We have Tim Flower back on the Deck Show, ladies and gentlemen, after an extended hiatus. How are you doing, Tim?
Part of the break was I'm building a house in Pennsylvania, not ready till April, and this is kind of a temporary gig for me. I spent some time with my parents out in sunny Arizona, and enjoy a little sunshine.
Very nice, very nice. And it's an all Nexthinker episode today because we are joined by Nexthink's healthcare director, first time on the show, Jonathan Butz. Jonathan, welcome.
Hi, everybody. Thank you for having me.
And we had to sort of we had to rush arrange this a little bit. We knew we wanted you on the show, but we had to do it all within 24 hours because I understand you're going on a trip tomorrow.
Yes.
Right? Is that so? What are you doing, man? What are you doing?
So I'm going to crew on a sailboat from Hampton, Virginia to Antigua in the Caribbean, and it's just there's an annual migration of folks who have sailboats in the Northeast to take their boats to the Bahamas and the Caribbean for the winter. And not all of them have everybody they need to do that. So this is a group that gets together to help coordinate the trip itself and those who need crew.
How long does it take to make that?
It's about
to make that trip.
It's 10 to 14 days. Obviously, heavily dependent on the weather conditions as you go. And sometimes they do a stop in Bermuda on the way. Sometimes they go direct, again, depending on the forecasted models and the conditions that people encounter on the way.
I did it the easy way, Jonathan. I went via Delta.
It's a very reliable way to go.
Yep.
I swam, so everybody representing a different tier of achievement on this particular trip. But we're welcome to the show, Jonathan. We're very happy to have you on. We wanted to have you on because we think that the whole intersection between healthcare and technology, which we know you really specialize and focus on and in, is a fascinating intersection. We wanted to hear a bit more about it. So first of all, tell the listeners a bit about yourself and how you came to specialize in this area and how you came to come to Nexthink also.
Sure. So I joined Nexthink last year in 2021 to develop our healthcare practice. And before doing that, I built the healthcare practice at Veeam, another software company. And I was also a part-time CTO for a couple hospitals, Temple University Health here in my backyard in Philadelphia, and John Muir Health out on the West Coast. And before that, I was a healthcare strategist and product manager at VMware. And I began my career a long time ago during the dot-com bubble at a startup doing end user support and end user computing. So I've seen lots of things improve over the years. The operating systems have gotten better, applications have gotten better, our operational models have improved. But the one thing that and I was just talking to a colleague about this a half an hour ago that really hasn't changed is our ability to understand what's going on the endpoints so that we can make appropriate corrective action.
Yeah, Jonathan, so regular listeners of the podcast know my story, the background of what I did at Hartford, come from a finance and insurance background, why I came here in 2015, a much different company, much different market in terms of employee experience. And when I came here, maybe I was a bit naive. I felt that everyone on the planet needed Nexthink. I don't think I'm naive in that respect. I think everybody does in terms of end user experience. But my naivety was more in the area of why different verticals or different segments needed it. My attitude was everyone experiences blue screens. Everyone has slow logons and slow boot ups. Everyone crashes Outlook. But over time, you see the different impact in different environments, whether it's finance, healthcare, manufacturing. What's your point of view in terms of healthcare, and what have you been kind of focusing on since you came here?
So I think to consider the nature of healthcare and its history. Healthcare is I think I personally live by principles of science and compassion, and I've gravitated to healthcare because healthcare lives by those same principles. It's a wonderful fusion of the science of research and treatment and then the compassion of person to person care, and technology emerged as a way to support the delivery of care over time, and it's only very recently through digital transformation that has shaped so many other industries as well that we've seen literally every aspect of care being now having some technological element imposed upon it. And when we consider some of the most critical roles in the delivery of care, the clinical staff, they now are forced to operate in the context of a workstation environment, spend most of their time in an electronic medical record system and other clinical applications. And that imposition of technology has reduced time that they can spend face to face with patients delivering care. And there's a ton of research to show that the imposition of the EMR in particular is a significant contributor to fatigue and burnout among clinicians, which is it's a problem that we've all heard about, especially during, it was exacerbated by COVID, but it existed before COVID. So anything that we can do to streamline and assure the proper operation of those clinical workstations and the applications delivered thereto gives the clinician that time back to pivot and face the patient, and allows the care to be conducted in the most efficient way possible. I think I saw a study over the summer. I was doing some research and I found a study that said if your average primary care physician did everything they were expected to do over the course of a day, their day would be something like 25 and a half hours long. So we're talking about a staff operating model that already doesn't have enough time. So to expect them, so consider our support models, right? Our inbound tickets are the typical indication of problems. But when we're talking about a staff that doesn't have time to do their primary work, they certainly don't have time to tell us about their technology issues. And our largest customer, our largest hospital health system customer, is a large integrated health system on the West Coast, who told us that about 2/3 of IT issues encountered by clinical staff go unreported, which means that model of supporting them is fundamentally misaligned to their needs and their level of activity. So intelligence is the only thing that can further address that problem. That is, understanding what is really happening on the endpoints themselves and any of the other operating environments where those applications are running or to which they're being delivered. Can allow us to efficiently make use of the staff that we have, make the clinicians as efficient as they can be in light of their need to use technology, and then also arm the support staff, which is yet another finite pool of resources, with the best information they can have to address issues that we may not know about directly from users reporting them directly, or the best information that they can have to work the issues about which they have been told.
So my assumption, Jonathan, just take it back a moment before we focus in on Dex a little more, is besides some of the factors that you enumerated there, technology in healthcare presents certain inherent challenges and issues, particularly around areas of governance, but around updates, around the modernity of equipment and hardware. It reminds me a little bit, in fact, of the sort of the air travel industry, whereby you have such high stakes around the service that's being delivered, but often people become quite loath to touch it, loath to amend it, loath to update it. Is that accurate, or how would you qualify that dynamic?
There's certainly some of that, and I think with regard to the back end and the clinical applications themselves, there's definitely high sensitivity there. But I think that without a doubt, that is a force. People are nervous to make change in general. And of course, we're talking about 24/7 operations, which makes change in general extraordinarily difficult because you have to work around. Scheduling windows simply don't exist in the sense that we generally see in other industries. But I would say the other one is just change is very difficult. Period. And this is a kind of change that I think is difficult for many organizations, and has proven to be even more difficult in healthcare. Is in that we know that the industry itself knows what it's doing. Its outcome is care. And a wonderful former CIO of John Muir told me once that the outcome of the work that we do in healthcare IT, the ultimate outcome, is the health and well-being of our communities at large. And so they know that that's their business, but technology is a facilitator of that business. It's not an inherent element, or at least it wasn't originally. It's weaving its way into the fabric of care in terms of analytics, population health management, and value-based care. But in the meantime, just changing how we think about anything is especially difficult. And in this case, we're talking about a fundamental difference in how support is even done. The shift from working tickets as they come in to mining a rich data set of intelligence about what's going on the endpoints and other application runtime environments it's a different cultural approach to doing support and end user computing architecture. And from experience everywhere, Honeywell talked about this, which I thought was really compelling, talked about the cultural transformation that was required in order to do that successfully, because the hero in the IT organization must change, because the person who gets their juice solving a problem interactively with a user is very different than the person who's looking for things that can be improved in an ongoing proactive fashion for which there is no immediate reward.
I loved that point in the presentation at Experience. It's great that you cite it. And of course, it's got a fascinating parallelism with the healthcare sector itself, right? Like, it's like if you suddenly told doctors, okay, we're just going to remove the hero element from your profession, you might have a bit of a culture shock.
It's a wonderful analogy. We're suddenly going to engineer a society where everybody is inherently healthy, and you as a doctor are going to prescribe what is necessary for people to be healthy. That's an entirely different reward and interaction with the customer.
But I love that alignment between healthcare, and I won't be able to phrase it the exact same way you did, but our charter is the health and well-being of the patients and the people in our care.
Yeah.
You could say, and I've said often, that the same goes for IT people. Our charter is the health and well-being of the devices and the employees that we care for, and the alignment of those two is too obvious to miss. I almost think sometimes that it's doing a disservice in healthcare to call it employee experience. Is it deeper than that? Is it a bigger deal? Even employee productivity doesn't give it the juice that it should have, right? We're moving from firefighters in the midst of sirens and lights and smoke and fire to Smokey the Bear, right? It's a different energy that you need to have.
Yeah.
But how do we do it the right service in healthcare?
So it's focus on, I mean, the when we consider the roles in healthcare and the personas in healthcare, I think the clinical staff is clearly the most important and the most visible, because they are the ones most directly related to the outcomes of care and that the ultimate outcome, which is the health and well-being of our community at large. So focusing on their needs and frankly, that because the nature of their role makes it so difficult for them to tell us what their needs are, we need a platform that can help us understand those needs directly and work to improve the nature of their situation in a much more proactive fashion. And then I think coupled with that, Lucy, I mentioned science and compassion, combining, scientific and quantitative and analytical elements to human elements. I think what we do with digital experience has those same two parallels, using an analysis of performance data and other experiential elements that we observe on the endpoints and other application runtimes, and then complementing that with user sentiment about various aspects of their experience, so we can understand the nature and scope of issues in the environment, and then add to that the richness of how much it matters. So we know login times as we move from terminal to terminal for clinicians. We know the login times is 45 to 60 seconds. How big a deal is that? Well, we can ask them. After they log in, how long we observe that how did you feel about how long it took to log in today? Give them a 7-point scale. Now we have some data to help us score and rate the impact of a condition we've observed that we can then use to prioritize our efforts to either remediate or acknowledge that level is acceptable.
And why do you think it matters? Why does employee experience or the experience of those healthcare providers, why does it really matter? What's the difference for a healthcare provider in a 5-minute login versus a 3-minute login, or a blue screen where they've just got another Windows on wheels, workstation on wheels that they can go use?
So all of those interruptions, I mean, the clinicians are generally roving from terminal to terminal. They're shared in patient rooms or in hallways or at nursing stations, and they're general purpose terminals that are backed by a variety of different infrastructures, VDI and terminal services and local applications as well. And so that because they move about so often over the course of the day, how long it takes them to transition from terminal to terminal has an impact on their productivity. And anything that can be done to improve that the efficacy and smoothness of that transition it gives them time back, time that we've already acknowledged they do not have an excess of. And I can't tell you how many stories I've heard over the last year, both within our own organization and in talking to prospects. How many people have stories they've told about visiting a doctor's office or a hospital where one of the topics of conversation has been the challenges with the workstation in the room. So I mean, not only does it have an effect on the clinician's overall experience and productivity, but that's not just bleeding into the patient encounter, it's sometimes a subject of the patient encounter. And it really shouldn't be, right? The technology should be a resource and a tool, a seamless element of the care experience, not an imposing and unwieldy adjunct.
100%. And actually, it reminded me. Last year I was doing a little bit of research into the healthcare sector and its relationship to technology, and I came upon an interesting trend in the healthcare sector called patient experience. Right? Yeah. It's a reorientation of how you measure the delivery of care and its effectiveness through patient experience, and it reminded me of something. Yeah, naturally enough, and I thought it was really interesting that to come back to that slight parallelism, that they've both been recentered in the same fashion. So, listen, Jonathan, I don't know how much you can go into our customers kind of by name necessarily, but would love to hear something about some of the sort of successes. Yeah. They've had using the technology, some of the value points and ROI you've been able to share with us today.
So I certainly can do that. And I did want to make one comment on patient experience, because patient experience is something that the hospitals and health systems have been aware of and focused on for many years, because they understand that particularly metro health systems that actually have competition, that's one of the ways that they ensure that they are attracting more prospective patients than their competition. And so they've invested a great deal of resource and made technology investments to understand the nature of patient experience. And I think it's only natural that now we are turning inward and starting to look at elements of employee experience and clinician experience as an essential element of patient experience, because of the consumption of technology that's required to deliver care. So on the stories front, I do have to recommend that everybody take a look at our Experience Everywhere content, because it is excellent, particularly sessions by Centene, Roche, and Johnson & Johnson, where they discuss a number of things. They discuss the value of experience. They discuss ROI through hardware, software, support, and staff productivity, all essential elements. And then I mentioned Honeywell, which I think is another fantastic story, even though it's not healthcare. But specific example, I did want to share some of the outcomes of one of our larger customers, which is a Texas health system. And I'm not mentioning them by name because so many hospitals and health systems are very sensitive about discussing the details of their operations and their technology choices. And I want to make sure that I respect that. But in this case, we partnered with them to measure the value delivered over a 12-month period. And we see this across the board, by the way. Our customers who take the time to measure the economic impact of experience see real returns on investment in excess of 250%. And some of them are so large, I wouldn't show them to prospects, because they wouldn't believe them. But when you look at the breakdown, it's real. So this is a particular large health system with more than 60 hospitals and many hundreds of clinics in their network. And I want to talk about a couple of the key ways that they were able to realize a savings. And one of them was a support contract for escalations. They were able to achieve a 40% reduction in on-site ticket dispatches, which equated to more than $1.5 million of annual savings. And that was done because of the information that we're able to provide the level 1 support services. So that many more tickets were able to be addressed and resolved within a much shorter time frame at the first level without needing to be escalated. And as I said, they had a support contract attached to escalation, so it was very easy to calculate the impact of that. And then that was a significant ROI all by itself, just that one element. And that wasn't even everything. I mean, I'm only talking about 4 of the 12 categories in which they realized real value over the course of that year. The other one, I mentioned software license reclamation. They saved $500,000 on software license reclamation because one of the things that we see, of course, applications and their operating metrics, but we also know how they're being used. We can see whether they're in focus or whether they're running in the background, which makes it very easy to find software that's active but not used. That is an opportunity to reclaim it from a licensing perspective. So in this case, it was a licensed version of the JRE that was never being actively engaged, and so could be replaced with the free version. So that was that's a $500,000 annuity. That wasn't just that year savings. That's ongoing $500,000 savings because it was not known prior to that. And then hardware savings I mentioned is another category. And this is in radiology workstations. The PACS imaging workstations are higher end pieces of equipment, between $10,000 and $15,000 a piece with very expensive and calibrated monitors associated with them. And there was a need for roughly 10 additional. And they used Nexthink to look at the utilization of existing imaging terminals around the hospital system, and they were able to identify the quantity that they needed in other locations that were not actively used. So having that intelligence about the nature of the end user space allowed an effective reallocation of existing capital, and it saved $150,000 just for that one instance. And then the last one was on the topic of stability in general. And it's difficult to attach dollar values to things like this, but I think the impact is still extraordinarily compelling. They were able to achieve a 90% reduction in critical application crashes. So they mapped their top 10 critical applications, which included a handful of clinical apps as well. And they charted how often each app crashed by what group of devices, and then that allowed them then to prioritize the remediative efforts, because obviously that's you don't know immediately what the source of each one of those is, and each application of course required a different remediative effort, but understanding the scope and impact of those application crashes allowed the prioritization of effort on the back end to research and resolve whatever the issue was with each of those 10 applications. And I think a 90% reduction in application crashes is a significant achievement on its own, even without an attached value. Again, all made possible by finally having adequate intelligence about what's really going on the endpoints.
And I've lived the business value and ROI in that space since I came to Nexthink, and just hearing a lot of what I do is before the purchase. What could we hypothetically accomplish with this capability? But as you said, to see customers measure it after the fact and bring some reality. I'll give you one example. Go back to the Honeywell presentation at Experience Everywhere. They calculated, and it wasn't even a full 12 months, it was year to date, so 10 or 11 months, 812,000 hours of productivity gained. And people will say, but it's productivity, it's not real dollars. Well, do the math. 812,000 hours is 400 people.
Yep.
400 people at $100,000 is $40 million. Yep. And they'll still say, but it's productivity. All right, let's take it one step further. Go hire 400 people and tell them to sit at their desk all day, every day, all year, and do nothing. It's insane the amount of money that you can put back into the business just with productivity.
We hear, you mentioned, challenges to things like DEX and healthcare. I have serving healthcare now for more than a decade. I have heard the objection to soft cost savings repeatedly for all different kinds of technology solutions. And it's true. It's very difficult to appreciate the value of time saved, but time saved is still real. Time not wasted on something unnecessary is time that can be spent on something that is more aligned to the outcomes of the business. And in this case, when we're talking about vital infrastructure that delivers the care and well-being of the community at large, I definitely want those soft cost savings so that my internal support people can focus on initiatives that are aligned to supporting clinicians, and so the clinicians themselves can spend more time face to face with their patients.
Imagine how much truer it is if you have a public health system. Absolutely. Jonathan, it was wonderful to listen to you there, and some incredible numbers and use cases. I'm really, really happy you could come on the show. And just to direct listeners to the show notes, where we will include links to all of those healthcare presentations that you were able to cite from experience, and some more relevant content as well, because we have on the Dex Hub some great healthcare related features, including something from yourself, I believe, Jonathan.
Yeah,
if memory serves me correct. I think you've been on the Dex Hub, and now you've been on the Dex Show. So it just remains for me to say thank you for coming, and best of luck. Be safe on your exciting trip tomorrow.
Thank you very much, and thank you for having me.
Thanks, Jonathan.
To make sure that you never miss an episode, subscribe to the show in Apple Podcasts, Spotify, or your favorite podcast player. And if you're listening on Apple Podcasts, make sure to leave a rating of the show. Just tap the number of stars you think the podcast deserves. If you'd like to learn more about how Nexthink can help you improve your digital employee experience, head over to nexthink.com. Thank you so much for listening. Until next time.